You may or may not be a patient individual, but as a medical doctor, you will always have patients. Well, that is a popular joke told among those in the medical field, and it is considered somewhat amusing. On a more serious note, doctors play an important role in our lives, no matter our ages, cultural background, or needs. Now, they often tell us to do what is right for our health, and most of them are caring and true to type. You may or may not have any, or rather have heard this, but most nations of the world dedicate a day to celebrate this group of professionals. It is called the National Doctors' Day. As a matter of fact, Doctors' Day is celebrated on different dates in different countries across the globe. In the United States, it is celebrated on March 30th every year, and in another country like India, it is celebrated on July 1st. Well, for us, it is more important, the underlying sacrifice of a National Doctors' Day. Apparently, the driving theme is the recognition of physicians, their work, and their contributions to society and the community. Indeed, doctors do amazing things. They save lives and improve lives. And so on this day, we say a big thank you to our doctors and for all they do for us and our loved ones. But even as we express gratitude, we also express concern over certain practices within the medical profession which seem absurd and a far cry from what should be. I'm talking about issues of quackery, wrong diagnosis, negligence, and most unfortunately, the nonchalant attitude of some doctors. Now, do we have cause to celebrate and perhaps evaluate the role of doctors in relation to development in Nigeria? We will get answers to these questions and many more. I am Anne Jibuno. Welcome to Nigeria Today. Now, in the studio to discuss the role of doctors in today's Nigeria and indeed the state of medical practice in the country is Dr. Maureen Omemwo. She's a consultant obstetrician and gynecologist at the Department of Obstetrics and Gynecology, National Hospital, Abuja. And Doctor, you're welcome to the program.
Thank you.
Doctor is also a fellow of she has many fellowships to her name. We also have Henry Ewunonu. He's a public health activist from the Nigerian Medical Association and also the head advocacy at the Nigerian Medical Association. Welcome to Nigeria Today, Doctor.
Good evening, viewers.
Now let's begin by talking about sacrifice and the Hippocratic Oath. When should a patient be concerned about maybe the professional conduct of their doctor? Maybe I'll start with you, Dr. Maureen.
Yes.
When should I, for instance, be concerned about the way the conduct of my doctor?
You know, considering our Hippocratic Oath, we are trained to save life. But as a patient, at the point of visitation, at the point of entering the hospital, most patients are apprehensive. So from that point, even at the record stage, there's a lot of expectations from the patient. So we need at that time to calm the patient down. And as a doctor, we are trained to handle patient as a pathetic patient, as somebody to care for. Because the people we deal with are the people that are already sick. A healthy person, especially in Nigeria, hardly come to hospital. So at that point of visitation, we are supposed to give them the care. The patient expects us to show concerns to them to the point of investigation, examination, diagnosis, investigation, and treatment. So doctors in Nigeria, despite the hectic and unpleasant state of the health in our country, we try as much as possible to make our patient to get that brought them to the hospital. So as a patient, from that point of entering the hospital, because the first contact is very important, they're apprehensive, and we're also trained to take care of them.
Now, Dr. Henry, do you have a contrary opinion? Or do you want to add to what she said?
Thank you, NTA, once more for giving doctors, Nigerian doctors, this prominence, this recognition. However, Nigerian doctors don't celebrate their own day on July 1. We celebrate ours. We call it the Physician's Day, or we use the whole week, the Physician's Week, in the second week of October annually.
Okay.
So ours is like that of one of these countries that celebrates on Brazil. Brazil marks theirs on October 18.
Okay.
And they are being a Catholic predominant country. They celebrate on St. Luke's Day.
Okay.
Now, about the Hippocratic Oath.
When should a patient be concerned about the professional conduct of
It is better to understand what the oath is. This oath that
briefly,
is...
please.
Yes, very quickly. The Hippocratic Oath, as the society understands, is about 2,500 years old. It was revised. The penultimate revision was in 1948, the Geneva Declaration. And on October 14th, 2017, this oath was finally revised by the World Medical Association to now be the doctor's pledge. There are many components of this oath about the patient's health being and concerns being the first consideration and everything. There are many components. Nigerian doctors are doing their best under the circumstances that found themselves.
So when should I be concerned as a patient?
Yes, from even any time in health, in sickness and in health. As my colleague has mentioned, unfortunately in our situation here, healthy people, apparently healthy people, don't seek treatment. But they should go to maintain their health. They should go to promote their health by periodic health visits. So that a patient should be concerned even from your house. The oath is about how doctors should relate with their clients, their patients, how they relate with their colleagues, how they relate with the community, how they relate to even their students, the medical students. Okay. So the concern is there. That is what guides us, part of the ethical code.
Now, Dr. Morin, now let's look at wrong diagnosis. What we seem to be having so many of such in recent times. Why are we having this? Well, why do we have this, and how do we address it? You go to the hospital, you have maybe a headache or your finger hurts, and they say it's cancer, or we hear very interesting things. Somebody's pregnant, they say the person has AIDS. I've heard very strange things.
Thank you, dear. The issue of wrong diagnosis. We have to start with the help-seeking behavior of average Nigeria. Because some of them can meet any person for diagnosis. The level of health we are in this country, you're supposed to meet a specialist. It's only when you now see that you met a specialist and the person couldn't give you a right diagnosis that I'll be worried at this doctor. But in Nigeria, everybody is a doctor. So, who gave you the diagnosis you are talking about? And in Nigeria, the rate of quackery is too high. So most people carrying the information over there, they are not actually meeting the right people. I'm not trying to exonerate doctors completely, no. But I'd say a higher percentage of this so-called wrong diagnosis is actually quackery. There's a lot of so-called private, not qualified doctors going on. So it's when you tell me you met a specialist and you were not given the correct treatment, I'll be worried. Okay. However, I will also emphasize that our health state, even though we've gained our independence for the past 58 years from our colonial masters, but the health state of Nigeria is still in a sorry state. Okay. If we don't have adequate infrastructure to make that diagnosis, we are not herbalists. We need infrastructure in the hospital. And even, can you believe that a country, Nigeria, because I have to talk of cancer, that is what is killing our people. We don't even have something like a PET scan that is in everywhere. Let's take example like India. If you go to India, a private hospital, they have PET scan.
Okay.
But in Nigeria, we don't have.
All right.
So infrastructural development is also very important. But a specialist is supposed to make the right diagnosis.
Okay, so
in
we
most
should
of
look
the
out
cases.
for specialists in
Yes, my
the area.
dear.
But I just wonder how the patient doesn't really know what's wrong with him or her. So, well, let's just leave that for now. Now, Dr. Henry, let's talk about sometime in 2018. We got a report that about 400 students failed their Medical and Dental Council of Nigeria exams. Are you worried that we have so many aspiring doctors, and why did such a huge number fail? How do we address the challenge?
I hope you permit me to
Briefly
give the background to that.
Very briefly,
The number of people that those people that failed are foreign medical graduates, those that trained in medical schools abroad. But the Medical and Dental Practitioners Act mandates the Medical and Dental Council to organize, call it a screening exam, is qualifying exam, to know whether, their suitability to practice here. For instance, if they are trained in countries that have eradicated malaria and cholera, and are coming to practice here, where malaria and cholera come first and second in the number of, in the list of diseases that affect us, they need to know, because once you're a doctor, you're on duty. The patient comes to you for help. So, at that exam, many of them failed. What led to that is that medical education, because of the importance of health, and they need to have doctors. In many countries, including where many people go to, they have commercialized medical education. Group of businessmen will come and use one duplex. They call it medical school.
So
the training is poor. So when they come here, they cannot meet. You see, despite all the things being said, our standard is still high.
Okay.
When we go out there, you still see Nigerian doctors measuring up very well, despite our constraints. So we still continue to commend, despite the interventions of the Nigerian Senate at that time, commend Medical and Dental Council of Nigeria for making sure that it is only practitioners that are wholesomely trained that should take care of Nigerians.
Now, you mentioned, Dr. Morin, you mentioned something about quackery. Now, when the council sits over an issue, let's talk about the council itself. When the council sits over an issue, these doctors guilty of negligence or whatever the issue is, what happens to them? Are you satisfied with the level of prosecution?
Oh, yes. You know that Medical and Dental Council of Nigeria, they are like our watchdogs, and they don't joke. It's just that Nigerians are not aware, or how will I say it? They talk about it and end it over there. Without moving to the right place, they're supposed to take their grievances. And once you are there or you've written to them, they are going to handle the case perfectly well. You can go to their office in Abuja and see the level of cases of different level of punishment being meted to doctors that have already been investigated and found guilty. But most of the thing we're having in this our country is newspaper or social media kind of prosecution. And we are not talking of the real thing going on. Ideally, I am not saying that there is no negligence going on, and I'm also not saying that doctors are 100% perfect. But if you feel that you were not treated well, why not write to Nigeria Medical and Dental Council? They are the statutory body that's supposed to handle cases like that. But what do we have? The next thing, either on the social media or other areas, they will judge, they will give the story, the history, judge, conclude, and do everything.
In other words, we should channel our grievances towards.
And they are doing perfectly well.
Okay, I'll stop you there. You're watching Nigeria Today on NTA News 24, and the topic is the role of medical doctors in the society and the state of medical practice in Nigeria. Earlier, our correspondent went to town to sample opinions on the matter and got some rather profound responses. Let's now hear some of what the people had to say.
The last time I was in the hospital, rather, the doctor I met actually attended to me very well. And though that period in time too, I think the doctors were on strike or something, but they were good.
My wife was about to put to bed, and she was just there waiting for, she was actually in the labor ward. That was on 9th, January 9 to 11 precisely, and there was a strike. And suddenly the management just came and said the shutdown, they have to shut down the hospital ward, shut down the labor ward, shut down everything. And they drove my wife and other women out of the hospital.
Our hospitals are very, very unkept. Very, very unkept. Sometimes you imagine what is happening in our hospitals, because the last time when I visited hospital and that, it got to be a very minor issue, but it took less than 4 hours for even the doctor to come in attendance. You go to the hospital, you see people lying on the floor, everywhere is unkept. People, in fact, you're going to die for what was not even going to kill you. Why? Because there was not quick response or attendance when it comes in terms of emergency.
In fact, they are doing well. There's no any hospital where I'm going to. If we try to attend to you, the way they are approaching very well, they get a lot of things to tell you. They will just ask you how the thing is worrying you. Is this the headache? Is this the stomach?
Federal government can make a law that if an accident victim or anybody that is sick come to the hospital, they first of all they attend to the person before they talk of maybe payment or whatever.
I don't need from government is to increase more manpower in most of the hospitals, because what you are facing most of in a public hospital is short of manpower.
You're watching Nigeria Today, and we're discussing medical practice in the country. We've just listened to what Nigerians have to say. Our guests are still here, Dr. Maureen Omemwo. She's a consultant obstetrician and gynecologist, Department of Obstetrics and Gynecology, National Hospital, Abuja. And Dr. Henry Ewunonu, he's the head advocacy Nigerian Medical Association. You wanted to respond to their comments very briefly, please.
Yes, very briefly. First, since this democratic experience started in the year 1999, cumulatively, the Medical and Dental Council of Nigeria has not been together for more than 6 to 7 years. Other years, about 13 years, either they have been in limbo because government dissolved them, the federal government dissolved them. First of all, the appeal goes to President Buhari to please not to dissolve Medical and Dental Council of Nigeria this time again, so that the council can stabilize it. The council has the investigation panel, then the tribunal. Okay. The tribunal has the same status as a high court, so they can adjudicate over these matters, investigate and punish, give sanctions. Secondly, about the demanding deposit or police permit, there is a law criminalizing demand for insistence on police report before treating, for instance, gunshot victims. But the National Health Act 2014 provides, in section 11, provides that 5% of that basic healthcare provision fund be dedicated for emergency treatment, using a formula to be devised by the Federal Ministry of Health. So Nigeria, the law has provided that emergency treatment be given to you while you stabilize. Okay. So please demand this. Again, when you are mistreated, demand for the next senior person. The Nigerian Patient Bill of Rights, produced by the Consumer Protection Council, has provided this. And every hospital is mandated to provide a dispute, malpractice resolution system that should address and redress, mistreatment of our clients.
Okay, now, Dr. Morin, yes, before you take this with your comments, do we have enough doctors in the country? We got a very worrisome figure, about 40,000 doctors. The enemy says we have about 40,000 doctors, and a population of about 196 million. Yes. So you take that with what you want to say briefly.
Okay, before I move to your question, the first one, from the comments they made, the issue of emergency coverage. Where I work, we have 24 hours emergency coverage. You are entitled to be treated for 24 hours before you are now mandated to make any payment. So despite the health state of the country, my own institution, they are really trying, because they will give you 24 hours coverage, and after that, you are not expected to pay. Then the second one, the manpower, which is also the question you asked, and the infrastructure. We also have to consider the hospital, and remember that the Heads of State 2001 agreed that 15% of our annual budget should be allocated to health. We are not talking about this. 2018, the allocation was 3.95%. 3.95. Then this current year is 4.1. So by the time we're talking of hospitals and the difficulties we're having at the hospital, we have to call our government.
Okay.
To still allocate 4.1 is still too poor for hospital to function maximally. The issue of manpower you just asked is clear. Enter our hospitals. The doctors have been overworked. Okay, patient will be like, the doctor didn't do this, didn't do that. But you see a young doctor, she will work from 8 to 4, move over for the same doctor till the day break.
So how do we reduce medical exodus of doctors?
And now we have brain drain. How can we reduce it when doctor's salary is still very poor? When you compose wait, if you compose, no, leave our local politics. But if you compose with developed countries or some countries within these African countries, within the West African countries, you will now compare with Nigerian doctors. And not only that, the brain drain is now escalating at alarming rate. Because the situation we found ourselves, until we're able to develop our health sector, allocate at least 10%, or even the 15% already agreed on when they had meeting 2001. Then start from our primary health care that is almost going into, how will I put them? It's already dilapidated. How do we consider that? Our teaching hospital, no fund, no grant. But if you want to carry any research in this country now, you would depend from the fund coming outside.
So what's the way forward, Dr. Henry? Very briefly, we're completely out of time.
Nigeria government, federal and state, local government, now there is autonomy, please employ healthcare workers, not only doctors. There is acute shortage in public institutions. Doctors are roaming the streets. They are not being employed by government at various levels. It may amaze you that there is embargo on employment of doctors, nurses, lab scientists, pharmacists in this country, where our people disease burden is so high. Secondly, there is a need, greater need for effective governance, leadership, oversight, supervision. Then the most important being accountability. It's a pity Nigerians didn't ask politicians question before the elections. What will you do for us in the area of health? How will you do it?
Okay.
So Nigerians should demand accountability. It is a shame that we are still 181 out of 187 countries.
I must stop you there, Dr. Henry Ewunonu. Thank you very much for your comments today. Public health activist from the Nigerian Medical Association and head advocacy, Nigerian Medical Association. Thank you for your comments.
Thank you very much.
And I must also say thank you, Dr. Maureen Omemwa. She's a consultant obstetrician and gynecologist at the Department of Obstetrics and Gynecology at National Hospital, Abuja.
Thank you.
Well, that's how far we can go on today's edition of the program. We thank you very much for your time.